Good evening, everyone. Welcome to Pratibimb, a webinar series for healthcare professionals. I am Surbhit Sharma, your host for the evening. This webinar is brought to you by Dr. Reddy's Foundation for Health Education. Dr. Reddy's Foundation for Health Education has been in the forefront of organizing soft skills and behavioral skills training programs for various healthcare professionals for more than a decade now. Customized training programs are held across the country to bring about transformation in delivering patient care. DRFHE has impacted more than 250,000 healthcare professionals till date, which includes more than 26,000 senior consultants, 138,000 nurses, more than 33,000 physicians assistants, 17,000 plus pharmacists, and more than 13,000 plus postgraduate doctors. DRFHE has also engaged 230,000 corporate employees for healthcare awareness through our Awareness for Life series till date. The topic for today's session is Skilling India for Healthier Tomorrow. And to deliver the same, we have with us today Mr. Ashish Jain, who is CEO of Healthcare Sector Skill Council. The key objective of Healthcare Sector Skill Council is to create a robust and vibrant ecosystem for a quality vocational education and skill development in healthcare space in the country through development of national occupational standards, development of appropriate courses and curriculum, accreditation and affiliation of training institutes, assessment and certification for trainees, placement support, and job aggregation. Currently, there are 32 national occupational standards for skill sets like cardiac care technician, dialysis technician, diabetes educator, etc. More than 5 lakh youth have been trained and certified through 500 plus centers running across India. HSSSC is a good source for hiring skilled staff to support doctors and healthcare establishments. Prior to this, Mr. Jain was working as a director at CII and has also worked for organizations like Pearson Education, GIFSM, and also the research associate at IIT Delhi. For the convenience of everyone, we would be happy to take the questions at the last. Now, without taking any more time, I would request Mr. Ashish to please take over from here. Thank you.
Thank you so much for this introduction. And I think I would say that Dr. Reddy Lab is doing a commendable work and the education as well, which I could hear now. So I think kudos to the team, which is being led by Mr. Satish Reddy himself. So great work. Good evening, everyone who is joined on this webinar. I think webinars are something which is the most in thing today for getting along to discuss, to chat things. And I think this is one of the mediums today which is actually helping us a lot to stay connected, to stay updated, and to share information, to share knowledge. And now we are using this to share the skill set as well, whatever skilling we do today. So what I'll do is before, as mentioned that, I'll briefly talk about what is Healthcare Sector Skill Council and what we do and how it can be beneficial for you, or how can you make use of it, or how you can support this. I'll cover all those. And then after that, probably I'll take all the questions, whichever you have. So I would request while I'm just presenting it, so you can note down your questions and we will take all those questions maybe later on as suggested by the moderator here. So to start with, I think I would like to thank all of you, because I think, today the doctors and the nurses and the paramedic staff is doing a tremendous job in the country to see that how we come out of this grave situation. And I'm sure you owe a lot of credit to do that as well. And all of you are doing something or the other, to support the country at this critical moment now. So coming to the presentation about today. So Healthcare Sector Skill Council is basically a unique initiative which actually comes under the Ministry of Skill Development and Entrepreneurship, and is constituted by CII, NSDC, and the most important part you will read out here is the key leading healthcare providers. It involves pharmaceutical companies, medical device company, diagnostic association, public and private companies, all. So what you will see is this is the unique initiative in itself, a start in itself, where the government has given us the powers and notified as a non-statutory certifying body for certifying the various skill sets but it is run generally and largely by the private sector, or the practitioners themselves. So what happens is the practitioner, like currently, I'll come to the next slide. So all the providers have come together, and if you look at the composition, we have the all sort of stakeholders on the healthcare sector skill council, so that we are as inclusive as possible. As I mentioned, Government of India has given us a non-statutory certifying power for certifying the skill sets of the healthcare professionals in the country. Currently, we have Dr. Naresh Trehan, who is the chairman of the Healthcare Sector Skill Council. And you can name the person. I think all of them institutions would be associated with us in one way or the other for sure. You can look at, Dr. Pratap Reddy from Apollo is the founder member and is the board member. Dr. Devi Shetty, Dr. Shabnam Chanjit Banerjee from the CII. And so you'll find a mix of people who are represented on the board. Dr. Randeep Guleria for AIIMS Delhi, which is part of the board as well. Then we have, from the lab, Dr. Arvind Lal is there. And then we also have the regional committees. So this is one of the, so we are not keeping anything and everything at Delhi level. So what we do is we are devolving the functions of the council at the regional level, at the state level. So like you see, Mr. Joy Chakravarti, who is the CEO of PD Hinduja Hospital, he's the regional chairman for West. Similarly, Rupak Barua, the CEO Emory, is the regional chairman for East. East. Similarly, we have other people who are managing things. Dr. Alexander Thomas, who is president of Anbai, also chairs our Karnataka office as well. So we had brought in multiple players, and we wanted to be as inclusive as possible, because the idea is not to limit things at center only. It has to go to states where the actual action takes place. This is broadly the scope for Healthcare Sector Skill Council. If you look at the root of the tree, it talks about skilling, reskilling, and upskilling. So we cover all three components here. Basically, skilling is required. What we talk about fresh skilling, which is new training, new skilling is done. Given the current scenario, as well as even before that, so a lot of technical changes were happening earlier, which may require reskilling and upskilling also. Any of the hospitals probably today require to reskill their staff or maybe upskill their staff as per the requirement. So if I talk about current situation today, so you may have a team with you, which is, say, for example, if you are somebody working in a lab, so probably your people or your staff would know how to collect sample and analyze them, but they would need some sort of skilling to actually see how they can do testing for COVID right now. So what kind of samples are required, how to collect a sample, although they may be aware, but I think there's some set of upskilling is required for those people also today. So similarly, what we do is, so if you see, there's an interesting aspect, I think, which the Ministry of Health earlier used to have. So earlier Ministry of Health used to, also include the Ayush component to it, which is now created a separate department. But what we have been recently mandated is that with the modern medicine, we've also given to work on the Ayush as well, very, very recently, a couple of months back. So we started bringing in the, working on both these segments. One is Ayush, one on the, allopathic side of it, and try and see how the strengths of both can, come together to treat a patient or to treat any of the citizens in the country that way. So those are broadly the areas which we work on right now. We are present pan-India, as the moderator has said, that we have 500 or more than 500 training centers across country. So there is no state in the country where we are not present, either through our training partners or offices, etc. So we are present across. As I said, 500. So we have around 620 districts in the countries. Going forward, we look forward to be present in every district. That's the aim we look for. We very, very closely work with the state skill development missions and the state school boards. I'll just like to take a minute to explain this to you. With the, when the new government came in, which is led by the Honorable Prime Minister Shri Narendra Modi ji, so it was, the new ministry was created, which is called Ministry of Skill Development and Entrepreneurship. After the creation of this ministry, what was also advised to all state governments, they should also create what is called state skill development missions. And I'm sure some of you may be aware of those facts. So each state either has a state skill development mission, or they have actually, have a nodal department who works on as a state skill development mission today. What this SSDMs do is that they actually look out and monitor the entire skilling activity happening in the state. They monitor it, they facilitate it, and they ensure the training happening is as per the requirement of the state. Similarly, another initiative which we have done is, and which we are participating, is the state school boards. So what is happening? Again, some of you may have already be aware of this fact as well. And you must have heard very recently in the newspapers as well, a couple of days back, that CBSE is going to introduce the skilling courses now from class 6th, 7th onwards, and then, in 11th and 12th as well. So what we are doing currently is, with the help of the Ministry of Human Resource and Development, state school boards, these are about not the CBSE school, we are talking about the state school boards right now. Those are actually been offering one of the skill courses from the class 9th onwards. So what happens if a student is in class 9, they take up a skill course which are available to them in multiple sectors, including the health sector as well. By the time they do finish their class 12, they also get one skill set within their hands about any particular role, any particular occupation. So in case they wanted to, they have to drop out by any reason, whether financial or whatever reasons may be, so they have some skill set with them through which they can actually earn their livelihood. So if you are aware of any statistics, so you would know that there are more than 50 to 60% of dropout happen at the class 10th and 12th level. So if 100 people have enrolled today, so probably only 40 would go beyond 12th. So that's the kind of dropout ratio which we have today in the country. So that becomes very, very useful, and that's how it's been working. Just wanted to share one of the major milestones for us is that even before the Ayushman Bharat was launched by the Honorable Prime Minister from the ramparts of the Red Fort, we started working on creating what we call Arogya Mitra. So some of the hospital or any of the hospital who is part or is empaneled with the Ayushman Bharat would have to have this Arogya Mitra, which actually becomes the facilitator between the beneficiary, which is the patient or their family, and how to avail the benefit of it. So that's, we had started working on developing that role, which means a person is trained on how to facilitate the entire thing. So we had signed, NSDC has signed an MOU with them to train 1 lakh Arogya Mitras over the period of 3 years. So that's what we're working on. We have a QP NOS behind it, or we have standards behind it. We are currently doing training of trainers. Some Arogya Mitras have been already trained, and we work very, very closely with National Health Authority for doing this. Another important thing which I just wanted to mention to you is, probably some of you may not be aware of this. Like any competition, like the Olympics, we have an Olympics for skills also. It's called World Skills Competition, held once in every 2 years. So it was held in 2019 in Russia by, dates you can see on yours. So India participated for the first time in the health and social care category. And many of, the healthcare providers in India actually helped train this girl, which is there on the slide. And I'm happy to share that this girl won for the first time Medallion of Excellence for the country. And it was all efforts from the, possible because of the efforts and training which she has undergone at various places across the country. I now briefly come to our mandate. You would like to know, I have spoken about skilling, reskilling and all, but what is the mandate of HSSC as a Healthcare Sector Skill Council? So I briefly cover this. So first and the foremost mandate which is given to us is the development of the national standards for, if you see at the bottom, for skilling, reskilling and upskilling. So what we have started is, we started working in the areas where we do not have any standards to start with. We didn't have any statutory body which is governing. So for example, we started working with Allied Health, where we do not have any standards per se or national standards per se. It all dependent on the training institutions. Some of them have very, very high standards which can meet or be benchmarked to any global standards also. But at the same time, there are institutions which are run in one room and offer diploma programs and diploma programs also in, for example, lab technician 3 months. So that's the kind of, variance we have in terms of the standards of training. So what we did is, as guided by the board and, we picked up the allied health sector first and started developing national standards for the occupations which are falling under the allied health. And the occupation which I mentioned, I'll show the list of occupation to you in subsequent slides. So that's the first and the foremost thing. While we develop any standard or any curriculum, our main objective is only one. If you look at the, the Skill India, Skill India objective is all aligned to what we do. So anything what we do is, anything we will develop is, we should have to have employment behind that. If there is no employment behind it, we'll not go and work in those areas. So our only one point agenda is, if we train a person, or if we have a curriculum, if we have a standard for a particular thing and we train people on that, they should be able to get an employment at the end of time, at the end of their training. So without it, we normally do not work on any of the standards. Second part comes is that we have created the standards, that is fine. But where would training happen on these standards? They also need to maintain certain standards. So what we do is we are doing the accreditation of training institutions where the training is imparted on these standards, which means that we have again the standards guideline for any institution to become a training institution. For a particular occupation, we would have the standard checklist of the equipment, what kind of training curriculum is required, what kind of trainer qualifications is required. All those are actually listed down on a paper, which everyone and anyone has to follow before they can actually start training on it. The other part is, and the most important part, which is going to be linked to all of you as well, is the assessment and certification. So once the training has happened for the person or the student who is enrolled in any of the institutions, so we carry the assessment and certification of the student through a third party. So we don't do the assessment ourselves. What we do is we actually involve examiners from practitioners or industry directly. So for instance, if any of you are working in the area of, let's say, you are a surgeon, OT, or working in OT or a cardiac care. So if we have to kind of test for a cardiac care technician, we'll bring those practitioners on the ground. So it's not an academician who is going to test. Is the practitioner who will test based on the predefined performance criteria. So while we create the national standards, we give the performance criteria which a student is already aware of. So these students are assessed on those predefined critical areas, and this is done by a practitioner on ground. So it's not somebody who will come only for academics and has no experience of actually practicing could do this. Based on the assessment, a student is certified. Those who are successful are certified. Those who are unsuccessful is not certified. And certification comes with Government of India stamp on it. So as I mentioned earlier, so we have been given the non-statutory certifying power by Government of India. So whichever certificates we issue through this process, Government of India stamp is also there on those certification. The next important thing, which is again very relevant for you to understand, is the recognition of prior learning. We have subsequent slides on them, so I'll talk about them. And the other part is the apprenticeship. And the most important, the critical, which I said in the beginning, is the placement support. Skill India is all meant about placement, getting jobs, and that's all we're looking at. So I'll talk about them a little later. And I think all of you all can be connected to what we are saying here. So to do whatever we are doing, as I said, as a mandate, we have to work very, very closely with industry, associations, hospitals, university, everybody, and the experts on the field. So if you see, it is just a suggestive list here that we work very, very closely with the various associations which are across country running, which are doing work in the healthcare area. We work with the manufacturers directly. We work with the hospitals, universities directly. We have an MOU with NABH also for recognition of certification under NABH standards as well. Somewhere in some of the places, this certification has become a mandatory certification for employment as well. As I already mentioned, we have been engaging with the industry and the sector through our regional committees and the state committees as well, which I mentioned earlier while we were going through the governing board. This is again a very, very selective list of our industry partners, founder members. So it's not the only list. We have just put it for a representation's sake, that the kind of, the partners we have, just to showcase that. So this is very, very just a representative of it. It's not the only list. This slide actually shows you how a standard is developed. I think I have not spoken about what is QP-NOS, so I'll take briefly 1 minute to actually explain what is QP-NOS. QP-NOS is what we call as a qualification pack dash national occupation standards. So how does it happen? I'll stick to my example of from the lab only for time being. Say for a phlebotomist who actually goes and draws sample, has three main roles. One is to draw sample, store it, and transport it. So these are the main role a phlebotomist has to do it. So three roles becomes three occupational standards for this role of phlebotomist. So what we do is, for each of these three components, we'll have the what we call, normally you understand, is the SOP, and the performance criteria for this. So once we have these SOPs for all these three things put together, that becomes a qualification pack. So qualification pack would be named as a phlebotomist, and the NOS would be 3 NOSes, which I talked about to you, is about drawing sample, storing it, and transporting. Those become the and those will become the national occupation standards once they are ratified through this process. So the process, as I'll show you, is shown on the slide, is it goes through multiple reviews before it can become a national occupation standard. Last and the foremost, the confirmation before it becomes approval is given by the National Skills Qualification Committee, which you will see it here. This is basically a committee which is headed by the Secretary, Ministry of Skill Development, and all the relevant government departments like Ministry of Health, MHRD, UGC, AICT, etc. were all part of this committee. And once they finally approve this, then this becomes the national qualification or national occupation standards. And this qualification are entered into a national qualification register. This is what, if you can see this. And then the training start happening on these roles. As I mentioned, these are some of the roles for which we already have the national occupation standards. And we have divided into various, things which I shown you on a tree earlier. So in the diagnostic side, we have some standards, and the curative side, non-direct care, rehabilitative as well. So if you look at the diagnostic side, we have the medical lab technician, X-ray technician, etc., etc. On the curative, we have EMT, which is current requirement is quite huge. Then we had dialysis technician, etc. Similarly, on the non-direct care, we also getting into medical equipment technician, which is one of the requirement as per the recent guidelines by the Ministry of Health, that it has to be either HSC certified or OEM certified if one has to work under the BMPP role kind of thing. Other than that, you will look at that we have what we call normally each hospital, even a single clinic hospital requires some people, which is called general duty assistant in our language. Another growing segment for us is the home-based care. So we have this role called home health aide, which are trained to provide services at the home, work with the patient at home in various areas. So that's the another one. Another upcoming area which we worked on is the geriatric care assistant, which is the elderly care. I think this demand is coming across globe right now. I think India has been approached by various countries. So India and Japan has signed an MOU where 300,000 people will be trained and sent to Japan for elderly care. So that's the kind of work which is happening. Similarly, we have GDA Advanced, which is again into critical care, into partition. So many things are there, so which can be utilized. We have a frontline health worker, which is doing excellent work in current scenario. And then we have the healthcare management roles, which is starting from front desk, patient relation executive, so on and so forth. We also have healthcare quality assurance manager. So if there is any hospital who is working on, and if you're working and you want your hospital to become, let's say, NABH accredited or JC accredited, so this person will become very, very useful for you, because this person is trained how to make hospital accredited. So that's what the training happens all about. Then, as I mentioned, in the Ayush, we have just developed 2 roles right now, yoga therapy assistant and Panchkarma, and we're working on a lot more on this. These are some of the upskilling courses which we are working on, which is about infection control, genetic counseling, IVF, ART, medical equipment, telemedicine. Current time, I think it become very, very relevant. So we already had worked on it. I think it's the final phases now. First stage is general program. So these are some of the areas where we're working on this, and we're creating more standards and the national standards, so that the training can happen on them. And those pool of trained manpower is there for our sector. While we create this, so we don't only create curriculum, we also create what we call is the participant handbook. So normally what we do is we have done a curriculum, but we also create a handbook which can be utilized by the participants who are undergoing training. Similarly, we develop another thing which is for trainer guide, how trainer can teach that particular thing. And then we have trained assessor and certified trainers, so that we have complete system. We may not have these resources for each and every curriculum right now, but we are developing them. So, but what we have right now for each, what you have seen in the list, we have a standard and we have a model curriculum, at least. And then we have the trained assessor and certified trainers for that. This is how it looked like. Normally the ones which we have done. So you can see the Government of India stamp comes on these as well. So for doing any of those things, there's only a single portal, which is skillindia.nsccindia.org. If you want to get affiliated, you have to go to this portal. If you want to find out where training is happening, you can go to this portal. If you have to find out which are the trainees, you can go to this portal. So this is one portal where you can find any and every information about skilling for all sectors. So it is not only limited to health, but any of the sectors. So if you're interested only for health, then you search for health sector and you will get the details there. This is the affiliation process. I don't know how many of you would be interested to it, but very, very briefly, I'll touch upon this in case somebody have any questions. I can answer that later. So that the affiliation process requires two set of process. One is the training provider registration. One is training center registration. So please note that it is not that if you are an institution that you will be provided an umbrella kind of an affiliation. You will be provided affiliation for a particular training center. Say, for example, if you're a big hospital and you have 2 training centers, you will have to get your 2 centers affiliated separately. So one is the training provider registration, which will happen as an umbrella one for you. And then you will add training centers under that. And each training center would have to have for a particular job role, for a particular occupation. It is not that whatever list I have shown you earlier, you can do training for all in one center, because the guidelines and the standards for each of the occupation will be different. And your center would be visited for all those things. So for what will happen, say for example, if you're wanting to do training in, let's say, home care, so then there's a certain set of equipment which is required. Similarly, if you want to do training for, let's say, geriatric care, there's a different set of equipment which is required for it. So you normally, from this process, you will only get affiliation for a particular job role. But if you want, you can get for multiple job roles also. Nobody stops you from doing that. If you have enough space and enough material and enough trainers with you to do that. As I was mentioning, recognition of prior learning is again, so recognition of prior learning, as the name suggests, is nothing basically recognizing the prior experience of the person. It is possible that, with you, there may be so many people who are working with you today and are not certified. I'll take another example. So, if you're an orthopedic doctor or a surgeon, probably you may have a guy who is working with you or a girl who is working with you as an X-ray technician, but actually she doesn't have any qualification with her to support that. She has learned or he has learned on the job, and you have trained him or somebody else has trained him or her. And that's how the person has learned on the job and does not have any valid certification. So within this recognition of prior learning, what has been done is a person can directly go for an assessment examination. If the person clears the examination, he or she is certified as a particular thing, as an X-ray technician or whichever job role they are taking up. And mind you, this is not something unique for India. This practice is adopted worldwide. So each of the multiple countries do this, and this is available across globe and recognized as well. Another important thing, I don't know how many of you fall under this category. This is an apprenticeship. So like you must have heard this, for example, any manufacturing firm has to have the apprenticeship in their organization as per the law, but only if it is mandatory. If you have more than 30 people, it is mandatory. If you have less than 30, it is optional. So in this case, if anybody is more interested, I can talk about this a little later. This is only during the apprentice period, a stipend is to be paid to the person. And based on this, what is shown on reflected on the slide right now, if it is class 5 to 9, 5,000 rupees, if 12th pass is 7,000 rupees per month, and so on and so forth. Placement support, which is very important, critical. I think that's the portal which we've created for placement, where we have all the people who are trained and certified by us are there. Anybody who is employer can come and post their requirements there. Even if we do not have anybody, let's say, on the portal for timing, we try and ensure that we make sure that you get that person which is required. We normally do it for first preferences given to HSC certified people to see that we can match it to the requirements. In case it is not there, we can give you the options of other people as well. It's very, very critical that, for us, because I said the employment is the most and the foremost thing for us. And that's why there's a lot of focus on the employment. You can associate with us in any form which has been shown as an individual, as an organization. Similarly, as an individual, you can be associated with us in these forms. Before I close this, I just wanted to share 2 more important things with you. One, as you, I think I've been talking to some people, I was told that probably currently everyone is bombarded by the information regarding COVID today and the training regarding the COVID, etc., etc. So I just add into one more, but I think you can find it a little different as well. So what we have done is we have taken what we call HSSC Mission COVID. Under this Mission COVID, what we are doing is we are developing training program, one for general healthcare workers, how they can assist, how they can help during the COVID situation, what is quarantine, what is isolation, how to collect sample, how to don PP, how to doff PP. All those things we are doing an online training which can be done by anybody and everybody, and it's free of cost. After the completion of training, a person has to go through of some assessment, and he or she can be certified also. So you get a certificate also. So once we are ready with the training, once we launch this, I'll request all of you to go through that training program as well, and ask your team as well to go through the training program so they get certified. Second important aspect is, which is again required by the country today, we are going to work on the program on the ventilator management. I think, which is again, it's a dire need today. Government has already said that they're going to purchase 40,000 more ventilators. So we would have the ventilators can be purchased, but where would that, the skilled manpower, a skilled workforce who knows how to work on the ventilator? So we are going to come up with a program very, very shortly on the ventilator management as well. Largely, it will be based only for doctors and to a certain extent for nurses. So any one of you are interested, please do enroll. I'll use this mechanism of Dr. Reddy's again to reach out to you. Anybody who's interested, please go through that, and you can do that as well. I think with this, I rest my, the presentation. My email ID is here. If anybody wants to reach to me later on any of the aspects, you can please write down, email to me. You can reach to me. I'll be happy to answer all those things. But for time now, I think I'll be happy to take any questions if they are.
Yeah, thank you, Mr. Ashish, for the wonderful talk. So we do have a few questions. I'll take them one by one. The first one is, so what are the new occupational standards that are under development? I mean, are there any apart from the ones, which you just shared?
So as I mentioned, there are multiple which are under development. And some of them I listed down in the upskilling areas as well. If the person has any interest in specific areas, do let us know. And based on that, we can, if you're not working, we can start working on those standards as well. But we are, as I said, we are guided only by the requirement. If there's any requirement of the role, we definitely work on those standards.
Okay, right. So this one question which asks for that, just in case if there is a requirement for a subject matter expert who can be, who are eager to help in this endeavor, is there a scope of an external faculty who can be a part of the programs?
Certainly, certainly. As I said, I think I'll just go back to the slide which I showed earlier. So this is the way anyone can participate and anyone can join. So they can become individual associate, they can part of the expert committees, they can be subject matter expert, they can become trainer, they can become examiner. So this is how they can all associate.
Great. So I think on the same line, we just got another question, or a statement rather, that I'm a faculty for benign anorectal advanced surgeries. How can I get involved in Skill India programs? So I think, sir, you have the answer on the slide in front of you, and you can get in touch with Mr. Ashish Jain on the email. The next one is, so how are the placements happening? I mean, what is the total placement percentage on an average? I mean, are we able to place all the people who get enrolled in the courses?
So I'll give you an answer for that, but just keep in mind that what we have done is, although we are training for almost, since 2014, 15 onwards, but we were not tracking on the placement. So what we have done is tracking of placement have started only last year.
Okay.
And that has become a mandate now. So I can give you a rough idea of what is the percentage which we have. So roughly we are placing almost, almost 60% to 65% candidates, 60 to 70% candidates, which are being trained today.
Okay, great. So are these courses free for students, and what about the guarantee for placement? So again, it's a mix of something which has been already covered, but then what about the fees, sir?
So there are two, there are multiple kind of programs which run today. So there's some which are free, where when I say free, it means that Government of India pays for the training cost, which is covered under various government schemes. And the flagship scheme for government for skilling is the PMKVY, which is Pradhan Mantri Kaushal Vikas Yojana. So under this, government actually takes care of the entire training cost of the student, and student would not have to pay anything. Similarly, we have other schemes which are run by the state governments and other ministries, like say, for example, Ministry of Rural Development run program called DDU-GKY, under which they also support training. Similarly, there are other institutions like for SC, ST, etc., who also for backward classes also, which do fund training. But not all trainings are funded by the Government of India. Idea of funding the training is only to those areas or to those people who cannot afford to do training. So idea is that if they role as such, which can earn them some money later on, so they would not be funded, which can earn good money. So there are two set of fund. One is funded by the government, and on not the selected basis, particular criteria which keep on changing from scheme to scheme. Others are fee-based program, or which are funded by CSR, or which student pays themselves. So there are multiple ways of it.
Okay. Next up is what is the scope in the field of dentistry, and do we have some course on dental assistant course?
We have a course called Dental Assistant,
okay.
Which is there. But I just wanted to share with you. So there is some, issue with the Dental Council of India on that particular course. I think we have been kind of trying to reach to Dental Council, but their idea is that it is the part of the Dental Council of India, and therefore Healthcare Sector Skill Council should not offer this course. So we are offering this course till June only, and after that we close this course because that's the duration of the program, and we'll not be offering this until unless we receive the clearance from either the government or the Dental Council on that.
Okay. The next one is, are there any hands-on training provided for quality assurance personnel?
Are we talking about the healthcare quality assurance manager?
I think yes. It's not specified, but looks like yeah.
Okay, so if that is the program, so this is the program we are yet to start training, because this has become the national standard just a month or 2 months back only. So training has to just commence on it, and then yes, hands-on training are provided largely through simulation based, and they can be part, and they normally are this is envisaged to be taken as an upskilling program. So it is expected that person would already be working in some hospital or some organization where the hands-on training can be provided.
Okay. How can we hire a person locally? I mean, is there any particular process for that?
As I shown, there is a website there. You can reach out and put your requirements there. If you're not able to get any requirement fulfilled from there as well, you can reach out to us directly. We'll be happy to assist you and get the person. And we can also share the list of training institutions which are there and doing training in your areas or your locality. So you can go and visit that as well. We can connect you with those as well. If by any chance we do not have the ready-made person which for what you're looking for, we can actually, what we can do is we can work with them in a sense to know their requirements and get those people trained.
Okay. Then, so we have a question asking for, is there any course on the clinical receptionists or general, the front desk operators?
So we have a course on a front desk executive, which is there now.
Sorry?
We have a program on hospital front desk. It is available.
Okay. Great. So probably the last one. So since we said that MOU is being signed between India and Japan to serve the elderly Japanese, can you please elaborate how to get involved in such programs or as the trainees or the trainers?
For this probably what has happened is, because this is the Government of India program, so they have floated an RFP some time back. under which people who are keen to work on it have registered themselves and got selected. Normally what happens under this, in our country right now, we have 22 organizations which are selected as a sending organization. So what happened, there's a sending organization from India, and there's a receiving organization in Japan who receive people from India. So for sending organization, as and when they open up again, they float in another RFP, probably you can get associated with them. Or the other way is that already existing 22 organization, you can get associated with them and can start working with them.
Okay. So, sir, I think we'll take the last one. Do we have any online help for NABH accreditation?
See, as I said, we do not provide any help for accreditation directly. So it's not about, whether we can provide that accreditation help or not. It's like we are preparing your team members to, so that they can maintain the quality as a regular aspect and not only for the accreditation purposes. And that's what I think NABH also envisaged. NABH accreditation is not meant for one-time aspect. It is continuous quality management kind of thing. And that's what we developed this person for.
That's a fair point, I guess, yes.
And I've seen one comment from Dr. Manoj Gupta. I'm so sorry, Dr. Manoj, that I've seen it a little later. If I have been going at a faster pace, if I had seen this, I could have actually slightly slowed down my pace. My apology that I couldn't see that earlier.
Yeah, great. So I think probably I guess most of our queries have been addressed. And with this, on behalf of Dr. Reddy's, I thank you, Mr. Ashish Jain, for taking your time out. I'm sure, the government is keeping you busy these days because in the lockdown and so many, things happening around the country. So I thank you on behalf of Dr. Reddy's and all the lovely participants for taking time out. And we wish that all your days be full of positivity, high on energy, and with good health, because good health can't wait. Thank you so much, everyone, for joining in. Thanks a lot.
Thank you. Thank you, everyone, for sparing their time. And if anybody needs anything, my email ID is there. You can just reach out to me directly as well. Thank you so much.
Sure. Thank you, sir.